Hello, I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida. The topic today is how to find the right antidepressant or anxiety medication. Materials you will need would be a computer to access the internet, to find an appropriate referral for a therapist or a psychiatrist, family physician, or a friend who may also have experienced or knows someone who has experienced anxiety or depression in the past. In order to determine which is the proper or the appropriate anxiety or depression medication, it's important for us to recognize, is the depression a thinking depression? Because most emotion, be it anxiety or depression, is nothing more than reflection of thought. Now, if your anxiety or depression is more cognitive in nature, thinking in nature, then you want to be somewhat concerned or at least cautious about jumping right into some anxiety or depression medication. If your depression or anxiety is really endogenous or biological, meaning you're kind of born with it, and as a result your brain chemistry is a little off at times, or you have some hormonal dysfunction, then looking at medication is an important piece. You can go to your family physician, but probably the best or more appropriate physician to go to is a psychiatrist. And they will help you to determine what kind of medication is useful. In the depression area, there's lots of medications. Certainly in 2010, we have many types of antidepressant medication. Anxiety, the medications aren't all that different, although a lot of the depression medication also has some anti-anxiety characteristics. So the best way to go about determining that is, one, see a counselor to determine whether or not your depression really is biologically driven or thinking driven. And if it's biologically driven, either get a referral from your psychotherapist or counselor, or from your family physician to talk to a psychiatrist about the appropriate match for you with the medication. I'm Dr. David Thomas, talking to you about the best way to go about finding the appropriate anti-anxiety or depression medication.